Hey, my name is Jenna, and these are my closing remarks on why family-centered care should be involved in critical care units. First, I want you to imagine that you have a loved one in the intensive care unit. Um, would you want to be included and know what was going on with their care, or would you feel comfortable just handing everything over to the doctors and healthcare providers? What if you were the patient? Would you want your family to be involved? Research shows that in a study involving 8,000 people, 90% of people stated that if they were to have an ICU admission, they would want to have their family members share in decisions about their care. In Canada, what made families satisfied was their participation in care delivery, discussions, and decisions. And there was an increase in family satisfaction when they were giving quality information. So, shouldn't we be giving them that information? Family-centered care is involving family from the very beginning. It's about effective communication between healthcare providers and families, being open and honest with them and offering them the opportunity to be included, allowing them to participate in care delivery, letting a mother paint her daughter's nails, letting a wife shave her husband's face. Research shows that family-centered care provides comfort and a sense of security for the critically ill patient, and it can also produce a calming effect. It's letting families participate in rounds so that they can be included in what's going on, preparing them ahead of time for the medical terminology, resident teaching, and brutally honest discussions that come with rounds. It's about taking a few minutes after rounds to clarify terms or answer any questions. Family-centered care can also be family watching a resuscitation. It's about letting the family share stories about the patient and understanding what that patient would want in the event that they may not survive. Families know the patient best, and they're able to advocate on their behalf. Family-centered care involves families participating in an end-of-life care discussion and decision-making. But even in units that are not family-centered care, families have the right to be a part of the decision-making process. Family-centered care is also respecting that some families might not want to be involved, and it is not our duty as care providers to determine what families should or shouldn't be involved in. That right is up to the patient and their family to make. Having a loved one in the ICU is a very stressful experience. Research shows that families can experience feelings of anxiety, helplessness, grief, depression, emotional distress, and PTSD, and those can last for years after admission. Studies have proven that family-centered care actually helps to decrease these symptoms. My opponent brought up that family-centered care causes moral distress, and I don't believe that to be true. Moral distress is an issue in nursing, and I will not downplay that, but it is not a result of family inclusion in care delivery. If anything, early effective communication and regular updates that occur in a family-centered care approach actually increase family understanding of prognosis and are likely to decrease futile situations from taking place. In relation to healthcare spending, if families are there to support their loved one, research shows that this saves the healthcare industry billions of dollars a year due to shorter hospitalizations. Family-centered care is evolving, and it's becoming more prominent in the critical care units. The question I really want you to think about is that if you had a family member in the critical care unit, wouldn't you want the option to be included? Thank you so much for listening.